Let's get started. This is part of our research and evaluation in action series, and so the idea is not necessarily I don't want to say, it's not the most, it doesn't have to be the most polished talk. In fact, we're really interested in people sharing with us their work that's in progress. And Renee is going to share some work that she's developing into a manuscript and is going to want some feedback about that. But first, I just want to say that it's unfortunate that Renee Johnson is no longer in my department. And we didn't even get to overlap.
I know.
It was really close. But she was in our department.
Is that coincidental?
No, it's not coincidental.
Absolutely not.
That's not nice. Renee is now at Hopkins. She got her doctoral degree at the University of North Carolina, School of Public Health, and in the Department of Health Behavior and Health Education there. She was, I have to read this one, she was an Alonzo Smith Yerby postdoctoral fellow at Harvard School of Public Health, and she studied suicide and youth violence there in the Harvard Youth Violence Prevention Center. And now she's Deputy Director of the Drug Dependence Epidemiology Training Program at Johns Hopkins School of Public Health, where she's also Assistant Professor in the Department of Mental Health. It's interesting. See how departments are, they can be different things.
We have a substance abuse research
see?
program.
Isn't it interesting? And she had been, when she was here, and is still focusing on adolescent risk behaviors in communities, substance use, violence, and an emphasis on low-income urban youth. So let's welcome Renee and hear what she has to say.
Thank you so much for coming, and I'm just really happy we were able to reschedule it, so thank you to Joanne and Dallas and Rich for working that out. So yes, I was here from 2009 until August, and I just wanted to say that I am somewhat new, not really new, but I haven't been doing substance use research for 10 years. So I'm new to this idea of substance use. And I had been doing injury and violence, so I may approach substance abuse policy and research more like a neophyte, which I think is a positive. I also want to say that this paper that I'm working on it with David Jernigan, and he is a serious expert in alcohol policy. So I kind of want to recognize him as a co-author, but he didn't kind of approve all of the slides, so he's not really a co-author. So just know that it was inspired a lot by things that I have learned from him, and I know he collaborates with people in the department. Okay, so I actually talked to a friend who judged a science project at Howard Medical University, and she saw an entire presentation about some disease with a very long name, and it was a great presentation. She realized she didn't know what the disease was at all. So although we probably all know what marijuana is, I'm just going to review it to start out with. It's a preparation of the cannabis sativa plant. It's used recreationally as a psychoactive drug and alternative medicine. The principal component is THC, but it also contains dozens of other cannabinoids, including cannabidiol and cannabinol. In terms of administration, it's smoked in cigarettes, pipes, or vaporizers, and vaporizers are when the plant is heated up and air comes out. It's a little easier on the lungs. It's also prepared in food and beverages. I don't say hash a lot, but hash is another preparation of marijuana, and that's when it's all reduced down to a liquid, and it's much more intense. So some of the short-term effects include euphoria, anxiety, relaxation, increased heart rate, dry mouth, and increased appetite. It's kind of idiosyncratic. Different people have different effects. But the euphoria and the relaxation is really what people are looking for when they use it recreationally or medically. I kind of love this graphic. So this is the use and production of marijuana around the world. And the darkest pink are the countries or nations with higher rates of marijuana use. So the United States is in there, as well as some Western European countries and Australia. The image of the cannabis sativa plant shows the main cultivation areas. So the US and Mexico, India, and some other countries are places where marijuana is grown. a lot. So you probably know that marijuana is the most commonly used illicit drug, which in the United States. You may not know that it's also the most commonly used illicit drug in the world, and 3/4 of illicit drug use globally is marijuana. So these data come from the National Survey on Drug Use and Health, most recent data, and it's ever used marijuana or hash by age category, with the red bars representing yes. So 12 to 17-year-olds, about 17% of them report ever using marijuana. About more than half of 18 to 25-year-olds, more than half of 26 to 34-year-olds, and then about 42% of 35 and older. This is the total number of days of marijuana used in the past month by age category. The red bar, I tried to break this up into sensible categories. So the red bar are people who rarely or never use. They reported 0 to 11 episodes of marijuana use in the past year. And you'll see that that's one of the highest bars. And then the other, the orange, use a pointer. The orange bars are the heavy users, and these folks are using more than 1 to 2, at least 1 to 2 times per week or more. You can also notice that these middle bars, the blue, green, and red, these are the occasional users, with the blue being about 1 to 2 times per month, the green being about more than 1 to 2 times per month, and the yellow being 1 to 2 times per week. So you can take away from this that marijuana use is not at all uncommon. It's quite common in this country. I'm going to skip those. Okay, so what's the federal status of marijuana? A question I'll be talking about for the next few slides is, will marijuana be legalized for recreational use, and should marijuana be legalized for recreational use? So I'll summarize a little bit of the literature that goes into this thinking. The 1937 Marijuana Tax Act prohibited use, production, sale, and procurement of marijuana. And in 1970, marijuana was classified by the DEA, the Drug Enforcement Agency, as a Schedule I substance. What it means to be a Schedule I substance is that there is no currently accepted medical use, and that it's among the most dangerous drugs with high potential for severe psychological or physical dependence. I'm getting confused looks, and we're going to talk this through about maybe it doesn't feel like it should be a Schedule I drug, so hold on. One of the kind of adverse consequences of it being a Schedule I drug is that it's really hard to do research on it, so that throughout this talk, I'll talk about like limitations on research and knowledge that we have, and a lot of that is because of the scheduling. And it's important to recognize that this decision was made without the usual scientific input that is required by the Controlled Substances Act. I'm not exactly sure what happened. It must have been some political thing, but they decided to use it as a Schedule I without scientists providing input about the impacts. Okay, so state laws pertaining to marijuana. So there are lots and lots of laws on the books and bills right now around marijuana. The main ones are decriminalization, medical, and legal use. Decriminalization basically means you're removing criminal penalties for possession. So what might happen is instead of it being a felony, possession would be a misdemeanor. You get a ticket or a fine or something like that. Medical marijuana, it's an alternative medicine, more like the things you might buy at GNC than a medicine you get from your doctor. But it's used for pain, multiple sclerosis, epilepsy, IBS, PTSD, migraines, and a whole host of other things. But it's important to say that this is kind of more anecdotal than anything else. To talk about intended uses works for pharmaceuticals, but not for medical marijuana. There's no FDA approval. And then finally, legalization. Some states have now started legalizing marijuana. I'm going to talk about which states have done what, but I wanted to make 2 comments. One, there's a lot of heterogeneity, so I've kind of chosen to classify states by their laws, but medical marijuana is not the same in Arizona as it is in Nevada. And also, in addition to state laws, there are local government ordinances as well, and that's not on this next map. And some of that is around people not wanting dispensaries in their neighborhoods or whatever. Okay, so this is not the most pretty map you'll ever see, and if anyone knows how to create maps, I'd love it if you redid this for me. But this is the patchwork quilt of marijuana policy right now in the United States. The purple states, Washington and Colorado, have legalized marijuana for recreational use, and this means that marijuana is simultaneously legal and illegal in those states, which has caused a whole host of issues and considerations around whether they can use banks or things like that. The blue states have medical marijuana laws and also have decriminalized marijuana. The green states have medical marijuana but not decriminalization. And the red states have decriminalization laws but not medical marijuana. And then finally, the pink are states that have bills pending around decriminalization. So half of the United States, half of the states in our country have laws, and I could have actually added a lot more. There are other states that are kind of putting together bills for legalization. So will marijuana be legalized for recreational purposes? It looks like there's a lot of momentum going in that direction. For the first time, majority of the United States believes that marijuana should be legalized for recreational purposes. I think a CNN poll or a Gallup poll polled adults in the U.S. and more than 50% said that they would. Another reason why marijuana might be legalized within the next 10 years is advocacy. There are a whole host of advocates and a lot of organizations really working very hard to legalize marijuana.
It seems like the momentum is not actually for legalization so far. It's a little disingenuous. I think it's for medical and for decriminalizing. It's not exactly for saying, yeah, we think this should be legal. Now you said the poll numbers suggest the majority.
Popular opinion supports it.
Yeah, but what they're doing in the legislatures seems to be a little bit different. Right?
Well, what's not on here are those states with bills.
Are there a lot of legalization bills pending? Or?
There are probably 3, and then California had one that was rejected, but I'm pretty sure that they will have another ballot.
I guess what I'm saying is it sounds like people are willing to say, well, we don't want to put these people in jail.
Yes.
Good.
Yes,
so let's
yes,
decriminalize.
certainly.
Or, we think that this is a medical thing. Let's make it medical, as opposed to saying clearly this is legal.
Right.
At least that's the choice that looks like it's been made so far in the states, most of them.
That is the choice that has been made so far, but I think the momentum is going in that direction based on popular opinion. But you raise a really good point, because politicians are it's the rare politician who comes out and says, I think it should be Schedule 2 and Schedule 1. Like, people just don't do that. The politicians are really kind of keeping mum on this. But I have a table. Remind me of what you asked. I have a table that you'll love.
Good.
Okay. Oh, so there are lots of advocates, and sometimes advocates even have strange bedfellows. For example, there are law enforcement organizations and individual law enforcement officers who vocally support ending the prohibition on cannabis. So there's a lot of momentum toward legalization. Okay, this is drugs shown for their harm to users and harm to others. I just want you to see the references, and it'll get bigger. Okay, so this researcher in the UK, David Nutt, tried to think about all of the drugs we have out there and quantify their level of harm to individual users and to society. So this is harm to users, and this axis is harm to society. So anything that's over here, in the left corner, really is not very dangerous to yourself. You're probably not going to hurt too many other people. And anything that's up here is really high impact on the user or potential on the user and to other people. So alcohol is one of those with a really high potential for harm to yourself and harm to others. And this is a controversial ranking.
Is this in aggregate or on a per person basis? You know, per user basis?
It's aggregate. And there were kind of arguments in the literature about it. Some people didn't like it. Some people thought tobacco should be higher, ecstasy should be higher. So it's really a way of thinking about it, and don't take this to heart. But what I did was take his graph and then highlight the drugs by how they're scheduled. So alcohol is not scheduled. It's not a controlled substance, and it's highlighted in blue, but you see how high it is. Tobacco, the same. Heroin is Schedule 1, and crack cocaine is Schedule 2. And then cannabis is over here, and that's Schedule 1, as well as LSD and ecstasy.
What schedule are the other ones?
They're all different ones. I figured I wouldn't drive you crazy. I think mushrooms, I can't even remember.
But almost all the other ones are prescribable.
If they have a medical use, they're not Schedule 1.
I can't find the copies of Walgreens though.
You're not taking enough of them.
And Nutt lost his job. Nutt lost his job. Over
He
this.
did, and he wrote a letter. It was really interesting. If you're a complete nerd and want to read the literature, you should read David Nutt's papers. And then he wrote a commentary about getting fired for basically saying that alcohol should probably be illegal and marijuana should be legal. And so he got government pushback, but then lots of support from other people. He sounds like an interesting guy.
Unfortunate last name.
It is. Well, and then they called it Nutgate after he got fired. I was like, oh. So this kind of paradox of how alcohol has lots of dangers but is not a controlled substance is really an important reason behind why advocates believe that cannabis should be rescheduled or legalized.
How much of this is prevalence, though? I mean, alcohol, you have massive distribution, you have marketing, you have promotion.
Yeah.
You have cultural, and once you start doing similar things with other substances, might they not
Do the same thing.
start
Yeah.
heading in that direction?
Exactly, and that's part of the question I'm trying to answer with this work is what happens if marijuana is legalized? Like, what happens in society? And that's not just a, oh my gosh, what happens, but it's also like, what do we need to do to mitigate possible problems? So we'll talk about advertising. I don't need to say this to this room, but alcohol, this is part of why David Nutt puts it where he does, but it's really a really big deal, kind of the third or fourth leading actual cause of death in the United States. So another strong reason that people give for legalizing marijuana and decriminalizing marijuana are criminal justice considerations. The U.S. prison population doubled from 1990 to 2000, and 75% of that increase was due to drug-related crimes. There is an unacceptably high racial disparity in arrests and prosecutions. African Americans are 4 times more likely to be charged for, or to be in jail for marijuana possession. 4 times something, I can't remember what I'm comparing. Those data are really compelling in terms of racial disparities. Putting people in jail for drugs has had an incredibly devastating impact on African American populations, and 1 in 15 African American children in this country has a parent in jail. So that sounds crazy, but then you think about the impact of it, and it's even crazier so you have this parent who, when they get out, will probably have some PTSD, will probably not really be economically stable for a long, long time, if ever, isn't allowed to vote. So it's kind of a ripple effect, and this is a really important consideration to think about. And some people argue that criminal punishment for marijuana is simply not justified. And that's a choice we have to make as a society. But the caveat to all of this research is what charges to prosecute. So sometimes law is all about, if you did something, maybe I know that you stole my TV or something, but I can't prove that, but I can prove that you had an ounce of marijuana, so people will charge on marijuana. So there are some issues around those data. this is what I wanted to talk to you about, Rich. So there is this neat article in Substance Use and Misuse, and the person's hypothesis was that we are approaching legalization. And why he said that is because the same arguments that are happening with legalizing marijuana reflect the arguments from ending prohibition. So people are saying that it's not impacting use, so it's illegal, but use is still quite high. People are not respecting the law. It breeds disrespect for the law because it's so common that everybody breaks this law. Talk about increasing revenue for the country through taxes, things like that. So it's a really interesting idea. I wanted to quickly, or not quickly, talk about harms associated with adolescent marijuana use because heretofore I've focused on the whole population. And there is an increased risk for substance use disorder. I read several articles about brain development, and I cannot explain to you what they mean, but I'm really convinced from the science that this is a critical period in brain development, and using marijuana early kind of tweaks some stuff. Young people who use marijuana in adolescence have persistent neurocognitive deficits, for example, in attention, learning, and memory, even after they stop using. And the severity is, widely variable. And this, not surprisingly, impacts school performance and lifetime earnings in the long term. Another thing that concerns me about adolescent marijuana use is that the people who are more likely to use are those adolescents who already have problems. And this is a kind of a failure of our society to make sure young people are being treated well, first of all, but also getting the psychiatric treatment that they need. So folks with a family history of addiction are more likely to use marijuana and then become addicted to it. Children with a history of adverse childhood events, which include the death of a parent or child maltreatment, things like that. Kids with mental health disorders like ADHD, kids who are victims of peer violence, and lesbian, gay, and bisexual and transgendered youth. The other issue, which is important for all people, but particularly for young people, is motor vehicle crashes. Adolescents are inexperienced drivers, and they have exponentially higher rates of crashes, even outside of substance use. So then adding substance use or marijuana use to the mix is really concerning. And there are some medical problems, but it looks like the research isn't that conclusive, and that it's nowhere nearly as severe as medical impacts, for example, for alcohol or tobacco.
Renee, before you move on, there are so many different definitions that people give for adolescent. So is there a cutoff in this literature? Do they define these, for instance, the problems with brain development happen if you use before age 18 or age 25?
Definitely before age 18. It looks like on average the articles are saying before 16, like between 13 and 16. And if, but the longer you can delay, the better for your brain.
Yeah, I'd say 13 to 16 is where you'd see risk for dependence as an adult. But if you look at the neurodevelopment, I think it's pretty consistent that it said that the frontal lobes, which adolescents have underdeveloped, things that control impulse, are not fully developed until around age 25.
And for men, it's like 60.
Yeah. There you go.
So I think clinically, if we can delay until they get out of high school, then that would be a great success. Another question that everyone is asking is, will adolescent marijuana use increase? Most people say yes, but then some people say no because use is already high, and even among adolescents who don't use, they report saying they could be using if they want to. So that's one argument. But the yes argument is impacted by price. The price is likely to fall by 10 to 40% due to efficiencies in production and distribution. So instead of having to have a grow house, in your basement and watch out, you can just have this, giant house with a sign and grow stuff, and it's much more efficient, and selling is much more efficient. Oh, people also think that adolescent marijuana use may increase because diversion is likely. So if it's legal for 22-year-olds, 22-year-olds know 17-year-olds, and it would be not very difficult to divert marijuana. And then finally, marijuana being legal normalizes use and might therefore increase use. However, the research is inconclusive. It's based on states that have passed it's based on what happened in states that passed medical marijuana. So we don't exactly know. One thing that I thought was interesting and worth saying is that alcohol use may decrease because the research or the best evidence says that people, when they have marijuana, either drink less alcohol in one sitting or choose not to drink alcohol. So it's kind of tricky when you think, well, how would that impact motor vehicle crashes, for example, or things like that? So lots and lots of thoughts. There's so much research to be done, everybody should be doing it. Yeah.
Another question about that, and that is, for someone who's not in that research area, couldn't these questions be answered? I mean, in Europe, we have several countries where you have legal marijuana use. So what's the impact there on the young population?
There are articles. I have a good answer for that too. It's inconclusive. Different countries have different impacts, and people really don't know. Like, I'm not really just saying it's not known, but it's a very international field, and people are comparing different countries and thinking about the best controls, and it's really unclear.
The problem, the U.S. is so different in some ways in how it treats social behavioral things that you could imagine. Some might call it a repressed, might characterize it as a repressed country, and other countries are not so. And so when you do something like this, it probably would affect here differently than it might affect. Can we really learn from the Netherlands? I don't know.
Right, and what happened in the Netherlands is not what happened in Portugal.
Or even between states, because there's so much difference in the different, even the medicalization laws. There's tremendous.
Yeah, Utah is always the lowest. And what I should have also put on this slide is that heavy use, those who use heavily may use more because it's cheaper. So will use increase in terms of the population? Maybe. Will use increase among daily users? Possibly. They might be using even more marijuana because it's cheaper. Who knows? Okay, so the rest of this is just me thinking through what policies should be put in place to mitigate the adverse impacts on youth. So based on this idea that you're way more likely to develop a substance use disorder if you start early because of brain stuff, the attention should really be aggressively on focusing delayed onset or delayed initiation of use. Obviously a minimum level age, as with alcohol. Strong efforts to prevent diversion. So one thing that has happened in the alcohol world is strong penalties for an adult buying alcohol for a young kid. Like, adults get in a lot of trouble for that, and are therefore more hesitant to do so. Also connect violations to license suspending. This would help prevent the motor vehicle crash stuff. So even if you were charged with possession but not driving while intoxicated and you get your license suspended, that's probably a really helpful idea to prevent harms to society. And then finally, effective strategies for youth offenders. I think I'm remembering this right, but I read a United States Preventive Task Force article about what are the best strategies for what physicians should do when a young person without a diagnosed substance use disorder is in their office. Like, what's the most effective thing to do to get them to stop? And there was no recommended strategy. So we really don't know what to do. I think there's some more strategies for those with disorders, but for those who are users in adolescence, we need to figure out what happens next. How do we treat that? And related to treatment and screening needs, particularly with those with disorders, there's a big treatment gap that needs to be closed. Teenagers are more likely than any other age group to receive the services they might need for substance use disorders. So an idea is screening and referral in clinics and schools, and where kids are. We need rigorous research to provide a strong evidence base for interventions and age-appropriate screening and treatment. And in order to do all of this, and I know this is dear to Rich's heart is a workforce of trained providers. So social workers, physicians, nurses, teachers, principals really need to understand addiction research. Okay, so how long do I have? Where's Joanne?
You got till 1.
Oh, perfect. Okay, so here are some lessons from alcohol policy, and this part of the presentation borrows a bit more heavily from David Jernigan's thinking. So every day, states and communities make decisions about the sale of alcohol, who can sell it, when and where it can be sold, who it can be sold to. State and local laws and policies control many aspects of the system by which alcohol is manufactured, marketed, sold, purchased, and consumed. Each element of the regulatory system provides opportunities for creating a healthier social environment with respect to alcohol. And I really like this quote and just want to replace alcohol with marijuana, because the idea is to create a healthier social environment. That's what we're doing with all of these regulations. So the first lesson is marijuana is not an ordinary commodity. And what this means is, well, I'll read this quote, which I also like. Alcohol is a legal and widely consumed commodity, but it is also a commodity that can create a variety of serious health and social problems. Alcohol policies are an important tool for preventing these problems. So this ordinary commodity concept is very important to alcohol policy researchers, and it was actually very strange for me. I think because I came out of the injury world, and I studied home safety and product safety and things like that. So I think of like every consumer product as potentially dangerous and regulated. So I mean, we look at sneakers. If sneakers cause people to fall or whatever, then there's an agency that does that. So I didn't get it. But I think it's actually this simple, is that what they mean is that alcohol causes a lot of problems and therefore needs a regulatory system. So the market is suited to ordinary commodities, not drugs. Like alcohol, the market will not regulate marijuana in a way that is healthy for young people. And this is just basically saying there are externalities, and to kind of mitigate those externalities, we need effective policy. So the lesson or the recommendation is that a marijuana control system needs to be carefully planned and maintained to minimize adverse impacts. Lesson 2 is to manage the size and power of the industry. It's really hard to think of marijuana becoming a giant corporation or corporate industry, but if the appropriate regulations are not in place, marijuana could be the new tobacco industry. So that's really worth thinking about. The alcohol industry is an oligopoly, and what this means is that the market is controlled by very few companies. And so those companies can kind of set prices and make decisions and decide on advertising and things like that. And that's not healthy for mitigating the social problems associated with a substance in society. It prevents other companies from entering the industry, and then it frees up so much money that they can just spend tons and tons of money on lobbying and marketing. Alcohol companies spend $20 million on lobbying at the federal level in 2010 alone. And the point of lobbying is to influence policy. So if there's this much of a voice in alcohol, in the alcohol industry, talking to Congress, then that really is going to impact what policies are made. The alcohol industry has one lobbyist for every 2 members of Congress, and alcohol companies gave $150 million to state political campaigns in a 10-year period. Ensure appropriate pricing. So just like any commodity, the price of marijuana or alcohol is going to impact who buys it, particularly for young people. So the idea in creating a regulatory system for marijuana would be to make sure that the prices are appropriately prohibitive. And there's a lot of evidence, this is one thing for which there's a strong evidence base, that higher prices are linked to lower consumption and lower problems. Okay, this is David's statement, don't let the governments get high on the revenues. And it's actually really interesting. I didn't know this much about the government, but the best place for marijuana regulation is not the Treasury or fiscal departments. It's really within the medical and public health authorities. Tax income needs to be secondary to the U.S. economy rather than central, or else it gets dependent on it, and that's just not a real healthy relationship. And this was part of what happened with prohibition. The U.S. government was actually had a substantial proportion of revenue coming from alcohol. So after prohibition, the income tax had to make up the difference. Another strategy for keeping the price appropriately high is to make sure that taxes keep up with inflation. So this compares real federal tax rates for beer, wine, and liquor, and you see that over time it's decreasing because it's not keeping up with inflation. It's also, this is Maryland alcohol tax revenues. It's not a great source of revenue for states. As a result, off-premise, meaning not using marijuana in a marijuana shop, beer is cheaper than water, orange juice, milk, and soda. And I did not believe this, but then I thought about it, like how much does a six-pack of beer cost and how much does bottled water cost? And it's actually true, really surprising. Milk is really expensive. So on-premise, alcohol is widely discounted. There are things like happy hours and ladies' nights. And we don't have happy hours here in Baltimore, but in Maryland there's so many happy hours. So it was really jarring, and that just promotes people drinking a lot. Every year, alcohol becomes more economically available. So the structure of taxing marijuana needs to have embedded within it some way for the tax to increase along with inflation, which is what the conclusion was. Okay. Lesson 5, create and safeguard government monopolies. So there is strong evidence that the stronger a government monopoly is for alcohol, the less likely, the lower the use. So what is a government monopoly? That means the government might regulate production, wholesale, or retail. For example, in Pennsylvania, you have to buy beer at a beer distributor's. That's more of a state monopoly in selling. And you have to buy wine or spirits in wine and spirit shops. That's what they actually call it. So that's a monopoly. So when we think of how will marijuana be sold, it would be a good idea for it to be sold within some sort of government monopolized outlet rather than Joe's marijuana shop or whatever. Some researchers have even recommended generic and non-branded cannabis, which would be really interesting for marketing. I mean, it would basically thwart marketing because everybody would be using the same product. I don't know that corporations would let that happen. Also, state-run outlets they manage hours, they manage locations. I've been thinking a lot about alcohol outlets, and in Baltimore, and I think everywhere, alcohol outlets are hotspots for violence. And I'm not sure that would happen with marijuana, but it might, and that's something people need to think about, and I know people were looking at it in California. But anyway, the more of a monopoly a state has on sales, they can regulate how many outlets there can be in a given city or per 100,000 persons or whatever. And they can also structure in a law that says as the population decreases, then it's got to go down. One problem in Baltimore is that the population has decreased by 1/3 in about 25 years, but the number of alcohol outlets hasn't decreased. So over time, there are more alcohol outlets per person. So something to think about for marijuana. And again, management needs to be under the control of health agents. Alcohol industry marketing. Alcohol advertising, marketing, and product promotions and placements by the tobacco and alcohol industries and pharmaceutical advertising are a pervasive influence on adolescents' substance-related attitudes and behavior. Which is something actually that the alcohol industry says is not true. They say that alcohol doesn't impact youth behavior, but spend billions on it. So I guess they just do it for fun. So these industries devote vast resources to effective promotion of their products and have significant financial incentives in expanding their customer base. So the lesson here from alcohol is to develop strong regulations on marketing. There's strong evidence from the alcohol world that marketing works, especially for youth. In addition, it normalizes youth. It makes you feel like when you're at a party, what you do is drink. When you're at dinner, what you do is have a glass of wine. And it also makes the product look more glamorous. Alcohol companies spend approximately $4 billion a year on marketing in the US. So the recommendation here is to market cannabis more like pharmaceuticals than like alcohol. There are really strong regulations on pharmaceutical advertising, and you hear probably about 4 seconds of side effects and warnings at the end of any commercial. And you know, they can't develop names that make it enticing. That's why the names are like Vioxx or Xanax or something, which doesn't culturally mean anything to you. It's not like the best cannabis you ever had, or like super cannabis or something.
Purple haze.
Purple, yeah, exactly. So that's interesting. Obviously ban marketing to children and youth, and also really restrict how companies can talk about the health effects of marijuana. So for alcohol, it's really interesting. David Jernigan has this entire slide of all the health marketing that's done with alcohol. So there's like gluten-free, soy-based, nitrate-free, diet. There's some with athletic trainers and just really pretending like this is a healthful thing, which gets in your head, and then you think, oh, you know, this is healthy beer. And then the alcohol industry is largely self-regulated, and that doesn't work. They violate their rules all the time. I think I'll talk about that in a second. But so the recommendation for marijuana would be government regulation of advertising rather than industry voluntary standards. So David's quote is, once the madmen get hold of marijuana, the floodgates will open and the tide will be difficult to turn. And I kind of agree. Like, if we don't do this now, once it's started, it's going to be really difficult to change things, especially with our culture in this country of really seeing corporations as people with free speech and things like that. So industry self-regulation, they violate their own codes. They'll say things like, don't market to kids, and there will be a commercial that clearly appeals to young people. And youth are exposed to more advertising per person than adults. And I think also developmentally, they're more tuned into it, and it means more to them, because they don't have 20 years of experience drinking and thoughts about drinking. And you know, I know that I don't like vodka. I don't need a commercial to tell me how great vodka is. I have, you know, personal experience with it. But a 13-year-old doesn't have that, so a vodka commercial or all of those Smirnoff things are really cool. I once babysat a teenager who had all of those ads in her room. So teenagers read magazines more, they listen to the radio more, they watch TV more, and there's also point-of-sale advertisements in shops. So they're seeing those, and the level at which point-of-sale advertisements are can appeal to young people. So there are a lot of strategies for regulating marketing. So the lesson summary here is marijuana is not an ordinary commodity. Manage the size and the power of the industry, ensure appropriate pricing, and create and safeguard state-run monopolies, and develop strong regulations for marketing. Just some other conclusions. I think we're at a point now. Oh, sorry, go ahead.
Oh, I just thought for the lessons, I mean, this is a good list of lessons, but do you think most states and or the federal government have the capacity to do these things, looking at the alcohol example?
You mean financial capacity or political will?
Well, I mean, the idea here is that I mean, I guess the idea is that it's to the extent that some people believe that it's inevitable it's going to become medicalized or legalized. These are good lessons to take from alcohol. But to the extent that the states really haven't been able to adequately regulate alcohol, that may be a concern with the idea that it may be a good idea to, or a good idea to legalize marijuana, let's say, as long as we can, quote, regulate it well. Because I guess, just to be clear, I don't think most states have the political will or the regulatory infrastructure or resources to do any of these things that you so wisely suggest. So
It is really hard. What do I have? What that reminds me of is that it's a stakeholder-driven political process. And on the one side, you have lots of money going in toward supporting corporations. And the political process in this country is really difficult to understand, and there's so many motivations. I don't know. I mean, I hope we do better. But how that happens, I think we need to think hard about.
Can I add one piece about how the industry goes about influencing policy, which is something that I think, among policy advocates and policy researchers, I think we've just completely dropped the ball on connecting with this and trying to put a stop to it. They fund a lot of alcohol research. They fund what they call to be prevention programs, and that puts them at the policy table, at the prevention table. Mm-hmm. And their lobbyists have more credibility as a result of it. Where I think at one time, many decades ago, when the industry talked about policies, I think it was more generally understood that their interests were their own self-interests. They could talk about economics and jobs, but now they can pretend like they care.
They've got credibility scopers,
right?
An increasing. That's interesting.
And that's really hard to fight.
Yeah.
Because they can pretend like they know what works, they know what doesn't, mm-hmm. and they fight against everything that works.
And just one point to add to that, I agree completely. And there's this double-edged sword of saying we should regulate this through health departments, mm-hmm. because then you can have the industry saying, well, look, the Food and Drug Administration approves it, or the Mass Department of Public Health approves it. And it's
right.
Like, how bad could it be? Because they're the ones who are looking out for your health.
It is.
So I mean, that probably is the place where it should be, but
right.
by the same token, it enables, them to duck and cover from the alcohol or marijuana side and say, the people who are most concerned about your health are already looking over this and they say it's okay.
Yeah. These are such tough questions. So I'm pretty much finished. I just wanted to say, in conclusion, that what legalization looks like really depends on the policies we develop, and our capacity to develop the most effective policies and to make changes when things don't work out. We don't know what's going to happen, but we need scientific evidence, in this. Can I say one more quick thing? And then I just wanted to say, give a plug for. We need more research, which means we need more researchers, and I co-direct the Drug Dependence Epidemiology Training Program. We have pre-docs. If you are thinking, or you have students who are thinking of applying to a doctoral program, please let me know, because we are always looking for people. And it's full tuition for up to 4 years. And hopefully we're creating, the new workforce of people to do this important policy work. So thank you. Allison?
I was just wondering if you knew, sort of from an advocacy perspective, what the advocacy organizations that are sort of pushing this legalization of marijuana down the pipe are hoping to, what their stance is on regulation and policy.
Ooh, that is a really wonderful question, and I don't know, and maybe that should be your dissertation. I'm going to look at that. I think they over-argue the tax revenue issue. That is one thing I've seen, and I don't know if that's a persuasive technique, like they think more people will support legalization if they say, oh, government doesn't have enough money, we need more money. But I feel like a government should be able to run without money from a substance. But they over... It's like schools and bake sales. Like, we should be able to fund schools without bake sales. So that's one thing they focus, and I know they really focus on the criminal justice disparities. But I I don't know what they, like how they'd respond, for example, to this presentation. Yes?
Yeah, I was just going to add that I think with alcohol prohibition, that was the same argument, that if you legalize it, you can get all of this tax revenue, and then
Right.
once it was legalized, then the industry came in and sort of prevented more, like keeping, like tax increases that would have kept the tax up with inflation,
Right.
and so then the value of it declined.
Yeah, yeah. Candace?
Great talk, Renee. Good to see you again. So what would this talk look like if you had replaced alcohol with tobacco? Like, what are the lessons
yeah.
from the tobacco industry?
I think the marketing would be very, very similar. I don't know about pricing. I mean, I know tax, the higher they cost, the less consumption is lower, but I don't know, about the real price of tobacco and how that's been different. What were my other lessons? Tobacco is not an ordinary commodity. That would be the same. Manage the size and the power of the industry. We missed the boat on that with tobacco, so it would be the same recommendation. Create and safeguard state-run monopolies. I don't think that. I mean, that would be one thing we learned, but that, we missed the boat on that with tobacco. That's a really good question. And I was actually thinking, because I have a colleague who does tobacco research, and she was saying, ooh, we should, talk about that as well. Oh, and I forgot to mention that I have another colleague in University of Southern California who runs the California Healthy Kids Survey, which is, and Ziming and Tim, we can talk about this, which is like the California's YRBS, and so we're going to do a trend analysis of how marijuana use among adolescents change to help answer that question of will adolescent use increase. Okay.
So one thing that, tying into the mental health piece of this, part of my dissertation research was looking at using marijuana for affect regulation.
Mm-hmm.
And so there's this definite tendency to, for people who are heavy users, many of them are, in fact,
Right.
have other comorbidities, including mental health
Yeah.
problems. And so one of the other potential issues of legalization is that we could have a lot more people self-medicating,
Mm-hmm.
and not really, not necessarily getting full, complete treatment of anxiety and
Right.
other disorders.
Yeah, I didn't put this in here. And this will look
Good job,
familiar
Renee.
to Rich, but I actually never really thought about that idea. Like, there are heavy users who clearly have substance use disorders, and they need some kind of tailored programs. And then there are these occasional users, and they need something else, and it might not be treatment, but it's something. So the idea of thinking about use as a spectrum and tailoring and doing research on that, like what you did momentary sampling, right, which is just a great idea. And then using that to kind of develop services for adolescents. Like, we need that. It's really important. And I don't know what healthy use of marijuana might look like, but it wouldn't be a self-medication. It wouldn't, I think it's not something that you need. It's something that you might do for fun, but not because you're so depressed you can't function, really. I would call that unhealthy use. Sarah? Hi.
Great to see you.
Great to see you too. Your hair is so different, but I love it.
Anyway, I have two questions about your incredible presentation. The first is, do you have any data or any sense of whether there's whether public opinion about marijuana legalization differs according to race, gender, socioeconomic status, anything like that?
I don't have it in my head, but I'm sure they did demographic stuff. Yeah.
Okay. And the second question is, do you have any thoughts about what legalization would mean for disparities in incarceration, particularly targeting minorities?
I should also say, in relation to your first question, the NAACP, I actually don't know if blacks overall are more supportive of marijuana legalization, but the NAACP has recently been vocal about being supportive of it because of the criminal justice disparity. So your second question was, do you think legalization would change? I do think so, but I really need to talk to somebody who knows the illicit drug markets about this, because there is some level at which, based on price and availability of marijuana legally, the black market would either disappear or go down or go up or whatever. So if there are not enough jobs in low-income urban areas, and if people sell drugs to for employment because there are fewer options in the mainstream economy, then does legalization disrupt that and contribute to gang violence or turf wars or something? I really don't know, and I think someone's got to think about that, but I don't even think I have the frameworks to think about how you might analyze that.
Or does use go up in minority communities for a variety of reasons, whether it has to do with price, whether it has to do with purchasing illegally because you're avoiding the tax, and so it's cheaper. If use goes up, that could counteract some of the benefits. I mean, obviously, it's not good to have people in jail for this stuff. It's crazy, and maybe the downside of more use isn't enough to counteract that. But I'd worry that it might disproportionately actually impact
because
minority communities. Yeah, go ahead.
In Colorado, for example, like in Colorado where it's legal to possess an ounce. That doesn't mean that everyone can go out and grow or distribute all the marijuana they want. And to the extent that legalization or sloppy medicalization leads to widely increased prevalence of use and higher demand overall, it actually creates an incentive for more illicit production. And then again, low-income groups have more of an economic incentive to engage in that kind of stuff because they need the money more. So I think it's a really important thing to think through.
Yeah.
I think a lot of people assume that because of the arrests and stuff that medicalizing or legalizing it is going to improve that. And then the other thing you have to think about is the arrests are one thing, but if use or problems in a particular group is going to be more, that's something else to think about. I mean, ultimately what we want is to maximize welfare for everyone, and clearly being incarcerated is not good for welfare, but neither is having very high prevalence of legal use if it's resulting in lots of problems.
Exactly.
And people are spending, also among people who aren't, let's say, selling it illegally, but are spending large proportions of their disposable income to acquire a legal drug that, let's face it, a lot of people wouldn't get if it weren't legal. Everyone likes to say, oh, the fact that it's legal just sort of makes the situation, doesn't change the situation, it just makes it not illegal. But that's not true, because the vast majority of people that, when stuff gets legalized, more people use it. I mean, contrary to popular belief, most people don't like to break the law. And there are a lot of people who would use marijuana if it were legal, who don't just because, for a variety of reasons, they don't want to.
Yeah. You started out by saying something about the criminal justice disparities, and it sparked in me the thought that one concern I get from advocacy organizations is like these really simple answers, like criminal justice disparities are wrong, legalizing it will change this. And yes, they are wrong, but the answer is so not simple. And I think because so much of our thinking around legalizing marijuana comes from the advocacy world, we're not acknowledging the complexities. And sometimes American society is not really able to even handle complexities like that. But yeah, I mean, it's complex. And I mean, like I said, people just charge for marijuana because it's what they can charge for. So these people may have been there for assault or something like that, and they just wanted someone who beat their wife behind bars, so they got him for something else. We don't know. There's so many unanswered questions.
So maybe this is a question for both you and Rich, but I assume that this diagram suggests that at the individual level, abstinence is the sort of goal. That's the target. If you want to minimize harm from alcohol use or whatever use, does the same principle apply at the social societal level? Should we be aiming for an abstinent society, or would we be better off as a low-risk use society where marijuana is concerned?
That's a big question that I cannot answer, but what I'm going to try to answer from this is, and correct me if I'm wrong, is that we're a little bit binary in substances. So it's like, oh, Candace, I'm your doctor. Do you have an alcohol use disorder? No? Okay, well, never mind. But some people come and they have sleep disturbances or, depression, and they're drinking to kind of control that. And so we're better at saying, you have a disorder, here's the treatment, than saying, like, you have some kind of unhealthy use going on. Let's talk about how to change that. So I think it's just making it not binary in how we deal with it, and recognizing that if you use any substance, it impacts, lots of contexts in your life. So we need to think about these occasional users. So I talked about the heavy users and the abstainers, but in between that are people who are using a couple times a month, or and how do we treat them? So is that?
Well, so the question, you could ask it for alcohol too. So there's no triangle for tobacco, right? So if the triangle were for tobacco, it would be abstinence and not abstinence, and no tobacco. Abstinence would be healthy, and using tobacco would be unhealthy.
But you would still stratify. I mean, there's a difference
Yeah, you
between
can still
whether I
talk
smoke
about
2 times a day or
dependence
once in a while.
Yeah, you can do all that, but really there's it's binary. It's sort of almost binary-ish for tobacco. Whereas for alcohol, we can come back to. For marijuana, one of the problems, or cannabis, one of the problems is we don't know where risk increases at how much use. There's lots of great studies, or I shouldn't even say great, but there's lots of observational studies of alcohol that give you a sense of where increases happen for certain outcomes. So at X number of drinks per day or week, the risk increases for A, B, or C outcome. We don't have that for cannabis. The studies even on, what are the most serious risks? The most serious risk might be psychosis, right, Tim? Psychosis and schizophrenia for adolescents. What?
And dependence.
And then marijuana dependence. So at what level of use does the risk for those things go up? And that might vary by at what age that use is measured. I don't think we have great data on that to say what's therefore risky use versus.
Well, you could argue that cognitive impairment is a greater long-term chronic risk than acute psychosis risk, right?
You could make that case too. You probably have to use. It depends. It is good that you did. I think that you separated adolescents from adults, because there are sort of different risks and maybe even longer-term risks from starting earlier. But I think that's the question. I mean, can you argue? You start with arguing: is marijuana zero risk? Is it no risk? Is it a no-risk proposition to use marijuana? I think the answer for that has to be no. It's not no risk.
Anything, it's no.
Yeah.
Anything?
I think roast beef is a health risk.
Well, so Rich related.
But there are lots of foods that are not risky, right?
We could argue,
choked on the carrot.
but I was actually, I'm as interested in the question of whether or not we should be aiming for sort of more of a Parisian kind of, approach and mentality to this, which is that it isn't so taboo, it isn't so fetishized, and it's tolerated and less harmful at maybe these different levels of use, or it's just, the way we have our history of treating substances in this country is so punitive. Marijuana has a lot of racial history associated with it as well. The reason it's illegal and alcohol is not is largely tied to race and the history of race and its association.
But in order to answer that, don't you want to know what the risks are?
The science
I
I think
do.
one
I mean,
of
I
the
read the
risks
alcohol
are-
research, and I am jealous because
Yeah, I know.
there is so much, they just know so much in finely detailed gradations. So this was one slide I didn't put, but, all we know about marijuana is frequency of use. That's it. Like, with alcohol, there's like, I forget.
It's harder to measure, right?
It is. But there's a lot of stuff.
But
we
Candace,
don't
I think
know.
there are a couple of ways to look at what you're asking, because one is, what are the consequences of a goal? So if the goal is abstinence, you're not going to achieve abstinence, most likely. And so what happens? Does that lead to a society that then has very heavy marijuana use or zero marijuana use? I think it's unanswered. It's an unanswered question. But that could be one way of thinking about, is it better to have an abstinence goal
I don't
or
actually know or purport to,
Yeah, I don't know what the answer would be.
But I think I would say, as a health professional, I'm not going to say I'm promoting healthy use of marijuana, but I would say I am discouraging unhealthy use of marijuana. I think that's the public health message, and other people
There is
can
no
do the other
evidence
thing.
of healthy use, though.
I don't-
And I guess the other principle to return to is the idea, and first of all, when it comes to alcohol, it's important to remember that, in Europe, the per capita, mortality from alcohol is twice that what it is in the United States. So but I think the key thing is to think about, the distribution of consumption, that when you have more casual use, you also have more, so it's sort of like the distribution shifts to the right and left. And I don't think people should be locked up, but I think it's a tough thing, but it's something different to say that they should be locked up and that versus to say that it should be legalized. So there's all these different gradations that I find tend to be conflated, that again, decriminalization is very different from legalization, is very different from medicalization.
I was thinking this more though as what I thought what you were asking me was about what the public health message would be, which is different from locking somebody up or criminalizing or so even, let's assume for the moment that cannabis were legal. Then the question would become, well, what's the public health recommendation about cannabis? Is the best for your health, considering health risks only, would the best recommendation be to not use cannabis or to use low-risk amounts of cannabis?
Wait, in a medical or public health context?
From a public health, like a recommendation.
Okay.
The CDC comes out and says, here's our recommendation. And I think there's nothing to suggest that anything other than abstinence would be the best health recommendation.
Right. But you could still legalize it.
That's
the thing also, people feel a need to, that if it's legalized, therefore they must find a health, so why, because that's another option. Legalize it, but don't recommend it as a health.
So what do we say about alcohol? We say, don't drink alcohol alone. Like, that's some message that, like, if you're drinking, no, seriously, I remember graduating from college and being a new alcohol user, and I was like, oh, I have a problem if I start drinking alone. Like, that was just some weird message that we got, and like, maybe that's what healthy.
For those who are asking about the advocacy piece of this, if you look at the Drug Policy Alliance in New York, they probably have the best advocacy in terms of trying to back it up with some science and everything. And their main argument has been about criminalizing people who use drugs in general. And they're not only about marijuana, but they fully admit, or at least their executive director in person to me fully admitted, and I told him I would repeat it, that they don't think there's any justification for medical marijuana. They think it's absurd. However, they're totally supportive of it. They completely support medical marijuana because they think it's better to have the substance be legal and not have people put in jail for it, which makes sense. It's just it's a silly. It's a disingenuous argument to say that.
And it shouldn't be tied to that because it's
and it gets
recreational like
tied.
driving cars and alcohol.
Right. So it gets
in the same way that
tied to
roast
it
beef
to
isn't
say this
necessarily recommended as a health tonic, but it's legal to eat roast beef.
It is.
Somebody who loves roast beef.
And I'm fully supportive.
Craig?
I think we can't lose sight of the economics and the commerce aspect of this, because
This is going to be R.J. Reynolds.
this is exactly, I
Absolutely.
mean, once you
question
take
about who's
this
gonna sell
underground
this.
economy and you monetize it and promote it, we're talking about enormous amounts of money. And when you think about our political economy and the media industry, which is, enormously enriched by politics nowadays, and you figure out that, trying to limit speech, commercial speech in this country, I think is a complete lost cause until we change, campaign reform and all that kind of stuff. I mean, there's just no way that we're going to be able to control branding, promotion, marketing. It's just going to be an absolute
Pessimism
nightmare.
might be the realism in this.
Yeah.
I hope it's not. But I have one request for all of you who do substance use research. I read so many articles where they say alcohol and other drugs, alcohol and other drugs. And I think it's just not fair. Like, we just can't continue to put marijuana in another. So as an
Especially
editor of a
since marijuana's the
journal,
majority,
yeah, like, I mean, we just need to stop doing that so that we can actually learn about marijuana.
So what's your recommendation? Alcohol?
Say tobacco, alcohol,
Say what you
marijuana,
need.
other drugs.
Yeah.
Like, I'm not saying you need a question for LSD and MDMA, but you need, marijuana deserves its own question, and I just am infuriated when I say it, and other drugs.
When Americans think of the Office of National Drug Control Policy, and when they think of the National Institute on Drug Abuse, no one is thinking about marijuana. They're not thinking that those agencies are mainly focused on marijuana. But when you look at identifying health identifying drugs in health settings, like you said, it's most of the drugs used in this country most of the drug is marijuana.
Yeah, yeah.
Everyone is thinking cocaine and heroin.
Right, but that's
not
quite
really
rare.
what those agencies are, it's not a drug.
Yeah,
Anyway,
so
it's
that's
a
a
good point to
professional
be very
thing we really
specific.
need to change. And like, yeah, I would across the board in your journal say,
Be
I
specific.
won't accept a paper unless you pull it out, Like, or have some good justification for not. And I'm gonna start like writing letters or something.
You should.
Yeah. Oh, yes,
Still
sir.
questions.
Can I ask a question that's kind of possibly
You can ask any
outside
question
the
you want.
scope of this, but
Yeah.
what do you think the U.S. responsibility on a global scale is for this in terms of responsibility of legalizing it for the production of it in other countries? As it's changed from a local crop to a cash crop and the impact on local communities, or in the perspective of, well, if the U.S. is legalizing this, what does this mean for other communities outside of the U.S.?
I haven't given that
It's another paper.
thought. Yeah,
I
that's
know
that's
it's a lot
interesting.
outside of it, but
I mean, I would be hesitant for the U.S. to kind of try to make policy for other countries. That bugs me. Like with
Not
climate
that they're
change, we're
making
like, you should be doing
policies,
this. And I'm like,
obviously something that the U.S. does just
Right.
because they are on that.
like
global
if we're
scale, like-
consuming lots of marijuana and kids in India are like
Right, well,
using
I mean,
it as a crop, then
we
is
start
that
eating
morally okay?
quinoa and
Yeah.
all the local communities no longer are
Yeah.
growing what they need to grow quinoa.
Yeah.
So if we all of a sudden have this mass need for additional marijuana,
Yeah.
what is that going to mean?
Is quinoa a problem?
It is.
Unhealthy quinoa.
Now,
Yes.
now in Peru, they have to eat roast beef.
Sarah, did you? I don't know. This is probably the last question, I guess.
I was wondering, in terms of talking about pulling apart marijuana from alcohol, from other drugs, have you found that some of the findings about the long-term impacts of marijuana are diluted because they're not taken apart from what are the long-term impacts of people?
I'll give you a specific example. I'm writing a paper on neighborhood context and marijuana use. And there are lots of papers on neighborhood context and alcohol use. So I pull all of those papers because lots of studies that look at alcohol use also say marijuana use. And they say, here's the odds ratio for gun violence and alcohol use in this country. Here's the odds ratio for gun violence and other illicit drugs. And that's what I mean. Like, say alcohol, marijuana, other illicit drugs, but just don't like put marijuana. It just deserves its own category.
But you're asking about the risks of marijuana specifically?
Yeah, I'm wondering if, and I don't know this for a fact, if people tend to be polysubstance users if they use a lot of marijuana, do they also tend to be using alcohol? How do you look at the long-term impacts of just marijuana when they're also being used in conjunction with other substances?
Right.
Has that been a problem?
So my personal answer to that question is latent variable analysis, which is kind of an algorithm that helps you figure out who people are. So yes, most people who use marijuana are also using alcohol. There are a few people who use marijuana and never use alcohol. But if you kind of get all these people and find out lots of information about their patterns of drug use and put them in an algorithm and then, have it spit back out at you, then you can see, oh, like, tobacco users tend to be daily tobacco users, and it's a technique that I think will be really important for understanding polysubstance use, and that's probably another recommendation I should have said is, we can't study these in silos. And the alcohol, marijuana, motor vehicle crash link was interesting because alcohol only is really bad for driving. Marijuana only is bad for driving. Alcohol and marijuana, who knows? If you're also high, you're probably a little less likely to be super, super drunk. So maybe alcohol and marijuana is somewhere in between marijuana and alcohol. But we only know that if we study it
I'd say
together.
the bigger, with addiction, the overlap, there is a lot of poly substance use. But there are, with non-addiction, that is with use or harmful use, or hazardous use, there are a lot of folks who focus on one much more than the other. So you can find, the study that I talked about earlier on Tuesday. Sorry. On Tuesday, that was a couple weeks ago. Whatever. We found people who were using drugs that we identified in primary care. We found lots of people who were just using marijuana, not just only, not using other drugs. Many were also drinking, but not necessarily heavy or frequent, certainly not frequent heavy drinking.
You can-
So
you
latent
can find
variable
populations
analysis.
that right out in a census.
Okay,
A latent variable analysis would identify those people.
Yeah, you can do that, but
Yeah.
if you, but better than latent variable analysis
Uh-huh.
is actually finding people who really only use that drug. It's just,
Okay.
if you can't find those people, then you have to use some other method.
I see.
But if you really want to know marijuana effects, it'd be best to look at people
Sure.
who only use marijuana.
Sure.
And there are a bunch of those people, but I mean, so I agree with you, but at
Yeah.
the same time, if you can find these other groups, it's also really useful.
Yeah, good point. Thank you so much for
Thank you,
coming.
Renee.
Great discussion.